Okay, we are back. Chapter 11, Part 6. Moving into more of this huge amount of information, which I hope you're understanding, and if you aren't, you know what to do. Let's move down into spinal cord, okay? And spinal cord injuries are generally from a direct injury. You can get tumors that can affect it as well. Or the injury from the spinal cord can come from the surrounding bones, tissues, blood vessels, your typical. Once again, I would never ask you these individual things, but some sort of trauma. You could get spinal cord injury also from osteoporosis, if you get fractures, or rheumatoid, if you get damage to the joints themselves, okay? Now, direct damage could happen to the spinal cord if it's pulled, pressed, sideways, or compressed. And I just wanted to bring this up because you can also get damage to the spinal cord with things like hyperflexion. If you have somebody who rolls their head far forward like a wrestler, if they get pulled really hard that way, it can actually contude the spine and cause spinal shock. And it's a very, very scary thing because the spinal cord has so little room to move. Because of that trauma to it with that hyperflexion, it gets a lot of swelling. That swelling pushes on the spinal cord, which will decrease neurological functions. Over time, when the swelling goes down, the neurological functions can return. So spinal shock is a good thing to know. It's a scary thing when it happens to somebody you know. Spinal cord injury complications. Once again, you can have effect with motor and sensory, because that's what travels through. And it could cause any of the functions that happen in the body. I think one of the ones that you should really earmark that I've spoken about before is gross loss of change in bowel and bladder function. That's known as cauda-equina syndrome. Well, you could get changes in bowel or bladder function other ways, but a very stereotypical sign of cauda-equina syndrome is gross loss of bowel or bladder function. So this is not like you have just peed your pants a little bit laughing. This is gross loss of it. Okay, you could get sexual dysfunction. Anything that you could think of that nerves go to can get damaged with spinal cord injury. Now, the thing with the spinal cord is it depends on the level what will be affected. So I like this picture. I got this obviously from offline. It breaks it down in a very simple diagram. So T1 or above will affect any area from the shoulders down, leading to quad, meaning four, quadriplegia, which is going to be loss of sensory and motor to the arms and the legs and the torso. Could also be respiratory dysfunctions or inability to breathe. T1 to T6, spinal cord injury, could lead to paraplegia, which would be just the lower extremities and chest down. T6 through T12 would also be paraplegia. That would be from waist down. L1 through L5 would be paraplegia, which would be hips down. So that would be a loss of sensation and motor function below those levels. So TIAs are transient ischemic attack. This is actually a brief stroke, right? I'm not laughing to me. That's funny. I'm laughing because I'm thinking about poor people who have this. But it'll be a temporary episode where basically a blood clot will cut off blood supply to the brain tissue beyond that area, which causes ischemia in that area, which will present as neurological defects or deficits just as if you're having a stroke. So they're also known as mini strokes. So usually these will resolve after 24 hours. Usually it's 1 or 2 hours. Typically if somebody's having that type of signs or symptoms, they're going to the hospital anyway. So this may occur singly or in a series of attacks. So what will happen is that blood clot will lodge in a blood vessel, cut off the blood supply beyond it, and they'll show those neurological deficits. The blood clot's small enough that generally the body will break it up, the clot will go away, and the person's okay. So this could be a warning sign of cerebral vascular accident or a stroke, or it may not, okay? 1 in 3 eventually may have a stroke. So they may have some issues with their clotting factors where they can't break down the clot. after it forms and they're throwing more clots than other people. Could be post-surgical, could be somebody that's on a medication that's not well regulated. Okay, but TIA is no laughing matter, as I laughed with the first one. It's something that really needs to be looked into, and the cause needs to be determined because it could lead to a cerebral vascular accident. So it could be ischemia from a clot, could be from plaque, it could be that artery is narrow and maybe you've turned your head the right way and that narrowing is pushed even more narrow. Could be spasms, could be some sort of injury, post-trauma, anything you could think of that would damage those blood vessels. Obviously, complications could be permanent brain damage if they don't get the proper treatment. They could lose their ability to rock properly, so they could fall, and there could eventually be a CVA in their future. As a previous slide noted, CVA can happen within 1 year of a TIA in half of those cases. So, can begin suddenly just like a stroke and last for a short period and then remit. And it will have the manifestations the same as a stroke, and that mnemonic of FAST I think is a good one. Could affect facial movements, arm, your speech, and it's time to get to the hospital if any of those are abnormal and you can't control them properly. Sometimes it'll reflect the location of the ischemia. If you have a TIA in your occipital lobe, you may not be able to see, for example. All right, so this is kind of backtracking a little bit to the anatomy, and I'm not going to give you a lot, but I wanted to give you the basics of the arterial supply to the brain before we move into cerebral vascular accidents. So, we have the internal carotids will actually come from the neck right into the center of the brain. And the internal carotids will supply the majority of blood into what's called the circle of Willis. So they've cut this out of the base of the brain and enlarged it so you can see it. Okay, so I do want you to know the internal carotids will come into the circle of Willis. And the circle of Willis is a circle at the base of the brain that leads to many branches that go out to the brain tissue itself. But the circle of Willis is going to be this neat little complex of blood vessels, and it kind of creates a backup plan. Because it's fed by the internal carotids and also vertebral arteries, which come up from your vertebra, it has 1, 2, 3, 4 main blood vessels that supply the circle of Willis, which then go out to the brain. And that's a great backup plan. If one of these gets blocked, you have the other 3, which can contribute to the circle of Willis and keep your brain functioning until hopefully you can get help. So, from the brain, and this is the arterial supply, by the way. Okay, so these are the arteries that supply the brain. You've got internal carotids, there are 2 of them. And these 2 down here are vertebral. I would write them for you, but it's hard to write with this pointer. So V-E-R-T-E-B-R-A-L, vertebral arteries. Okay, vertebrals turn into basilar, which is just 1, and they all feed the circle of Willis, which is at the base of the brain and provides a blood supply to the entire brain. So, that being said, we can now get into cerebral vascular accidents. And these are stroke or brain attacks. I think they were calling them brain attacks for a while, and then they stopped. I don't know. Anyway, it's going to be an interruption of that arterial blood supply. So it could be a clot or it could be a vessel rupture. It's important to know which is which before you treat them. Either way, the brain tissue beyond that damaged blood vessel is going to become ischemic, which means it loses blood supply, which it loses glucose and oxygen. So with ischemic strokes, you could get a blood clot or you could get a plaque that'll close off the blood vessel. Usually with plaquing, the last step is a little teeny tiny blood clot that blocks it. That's pretty common. You can also get a hemorrhagic stroke, which is most fatal because a blood vessel breaks open. there's an excessive amount of blood that gets into the brain tissue. So your brain tissue, and it gets into the cerebral spinal fluid as well. It can allow infections to get in. It can stop the blood supply to that specific area itself. And it can infect the brain and eventually the meninges if it continues. Remember with the blood vessels in the brain, all of the blood vessels that go into the brain tissue are surrounded by cells which help to allow only substances out that feed and nourish the brain, and it keeps bacteria and viruses in the blood vessels. It's called the blood-brain barrier. Okay, and that blood-brain barrier is very important on these blood vessels, so it doesn't allow infectious agents to get in. With a hemorrhage, the blood-brain barrier is gone, and all the blood, good and bad, bacteria, whatnot, gets into that brain tissue, and it damages it, and it dies. So, neurological deficits as well. This can also lead to death if it's not treated quickly. So manifestations are similar to TIA. I gave you that fast mnemonic. It may improve with time if they get treatment and their symptoms resolve. Some people have permanent damage to some of their brain tissue, but quite often we can work other areas of the brain to pick up the slack for that damaged tissue. So, with a CVA, they have to have a diagnosis first. So they need to have some sort of CT or MRI to see if it's a blockage or a hemorrhage before they get treatment. So let's look at an example here, a little practice. What condition is this and why? Out of what we've looked at, what we have looked at, what do you think? You can pause it if you need to. Normal's on the right, abnormal's on the left. Oh. This is going to be a cerebral aneurysm, a blockage. You can see to the right the blood vessels, and they're functioning properly. To the left, they're blocked. That entire left side is blocked, and they're not getting blood supply out there. All right, CVA treatment. So prompt treatment, you've got to diagnose which it is first. In hemorrhagic, you'll get surgical repair if it can be repaired. Quite often in brain it can't. If it's abdominal, there's a better chance because you'll see it earlier and you can repair it. Usually in the brain, when it happens so quick that the patient passes away. With ischemic, though, they have really good treatment for it, and they'll give them agents to break down those blood clots, such as TPA or thrombolytic agents, aspirin, angioplasty if they need it. But that treatment with those thrombolytic agents has to be quick, usually within 3 hours of the symptom onset. Okay, so cerebral aneurysm is going to be an outpouching of a cerebral artery due to weakening of those walls, just like we looked at in abdominal aorta aneurysms. So this can put pressure on the surrounding tissue, but the real damage is if it starts to leak or it ruptures, leading to a CVA. And once again, this would be that hemorrhagic stroke. So most are either berry or saccular. So berry would look like it's on a stalk, kind of, or a saccular. I have a couple of examples on a picture. Most frequently occur in multiples or on that circle of Willis that we looked at in the center of that brain. So, quite often, these are asymptomatic until they grow large enough to rupture or compress on surrounding structures. Once again, nerves don't like pressure. So even the pressure from a cerebral aneurysm can put pressure on nerves in the brain or structures in the brain, and you can have symptoms from it. Once again, any neurological symptoms. But if they have a sudden, severe headache, it could be an indication that that aneurysm has ruptured. You can also get symptoms that will represent or resemble intracranial pressure or a CVA. So, this is going to be an example of what, do you think? Everybody's got it already. These are going to be aneurysms. So they didn't mention fusiform in the notes, but fusiform is a distension on both sides. Saccular is that berry aneurysm where it looks like a berry on a stalk. All right, I'm going to take a little break at this point, and we will pick up in the next video. Please let me know if you have any questions. I'd be happy to get back to you. Thanks, and have a good one.